Keith McCarter and his wife Jessica know about putting their life in danger. They served together in Iraq. But the McCarter family's real fight for survival didn't come until after their tour of duty ended in 2006. Keith started feeling sick.
I went to the doctors a couple of times. They kept on giving me antibiotics. They said it was an upper respiratory infection, and that's what we went with.
You keep going to the doctors, and they were diagnosing him with asthma and upper respiratory. Every thought, every single day was getting Keith over to UW.
Keith came to UW Health as part of their second opinion program. Keith, who was just 25 years old, was diagnosed with congestive heart failure and put on the transplant list.
Transplant was a really big shocker, actually. But when I heard that, I actually knew that something had to be done.
A left ventricle assist device, or LVAD, was surgically implanted to keep Keith alive until a heart became available.
Even though I knew Keith was extremely ill, I knew that he was in good hands and I could kind of breathe now.
But after his surgery, a complication. Medicine he was taking affected his thyroid and caused him to gain so much weight he was no longer eligible for a transplant.
At that point, we had to make a decision on how can I get back below and stay below. You know, a diet might get me back there, but I might not be able to stay there.
Enter UW Health bariatric surgeon, Dr. Michael Guerin.
So I got the consultation notes, and I will readily admit my first thought was, this is crazy. Here's a guy essentially with an artificial heart in place, and we're talking about doing an elective operation, a bariatric surgical operation.
Dr. Guerin has done hundreds of bariatric surgeries to help patients lose weight and improve their health. But he had never done a surgery on a patient with an implanted LVAD. In fact, the surgery had never been done in Wisconsin before, and the procedure came with added risks.
I knew there were some mechanical things about the surgery that would be a little bit different. I know the view that I would have would be obscured somewhat by this device that sits in the upper abdomen. Because of the artificial heart, he had to be on some fairly high-dose blood thinners, which is a tricky thing around any major surgery, certainly this type of surgery as well. As scared as I was, I can guarantee you Keith and his wife were more scared of the prospects of both having bariatric surgery, but probably more so not having bariatric surgery and never having the opportunity to get his heart transplant.
Keith's surgery was a success, and soon the weight started peeling off, close to 50 pounds in the first month. So far, he's lost over 100 pounds. And because of that weight loss, doctors were able to remove the LVAD, and his original heart is able to do the job. For now, Keith doesn't need a transplant.
I feel great. I feel like my old self again, pretty much.
To go through everything that Keith did and his family to get to that point is the best feeling ever.
I've been overseas and fought in a war, and now I'm over here, and I was fighting a war over here for my life, and I've been through a lot. And now I'm just trying to move forward, you know, live my life now.